Welcome to the Wellness Growth Show, where we dive into the strategies, systems, and stories behind building scalable wellness businesses. I'm your host, Scott Schumann, growth partner to wellness and health tech founders who are moving beyond one-to-one delivery and into organizations, employers, and institutions. Each week, I sit down with the people actually doing the work, founders and operators growing mission-driven platforms that create real impact and sustainable revenue. Whether you're pivoting from B2C, landing your first corporate wellness contract, or scaling into institutional partnerships, this show is here to meet you where you are, with honest insights, tactical conversations, and zero fluff. Let's get into it. Today we are sitting with James Marlin, founder of IVRS Wellness Center located in Texas. Welcome, James.
Thank you, sir. Happy to be here.
Happy you're here, man. Happy you're here. So I would love to, man, I'm really impressed with your business concept, and I would love for you to share the background and just founding story of your center. Like what inspired you to start this journey?
So I come from the medical background. I did orthopedic sales and surgical. So I've always been in the medical field. And about 14 years ago, I was diagnosed with a rare liver disease called PSC. About that time, I actually had the business idea that I wanted a nurse to come to my house to give me an IV. I just had no idea what I wanted in it. And so I started doing some research of other ways to take care of yourself. Came across IV vitamins, met with a physician, talked with her, tried an IV, and that night I basically decided that I wanted to set this thing in motion because with my liver disease, I was just super unhealthy. I felt bad. I was overweight. I was all the typical things. And so for me, I was given about a 10-year shelf life, so to speak, after I was diagnosed. So for me, it was the passion of trying to educate people different ways to take care of yourself besides just waiting until you get sick, go to the doctor, take some pills, same old cycle. So started the company about 8.5 years ago, just as a IV vitamin hydration company in West Texas, which IV vitamins 8.5 years ago were not near as popular as they are today. Yeah. Especially in West Texas. We're not always known for just being trying new things and cutting edge in the medical field.
Yeah. Okay.
So we started off just as IV vitamin hydration company. And 6 months later, we moved from Lubbock to Amarillo. So we had both cities and just continued to grow and build with the vision of having a place where you can come get a treatment, of all kinds. We have functional medicine where we try to dive into more what's going on with your body, not just, hey, here's some IVs or, hey, you're sick, take this pill. So we really have built into more of a functional medicine wellness center, not just an IV, an IV bar, so to speak.
Okay. And tell me more about that. Like what sets you apart? What's different? And I'm sure you've evolved quite a bit from the first concept, and can you go a little bit more deep into like what is different, like from the so you walk in to
with functional medicine or integrative medicine, we more try to treat the body, not just treat the symptom. So whether it is something simple like IV vitamins, we can do things called micronutrient panels that can identify every vitamin and mineral in your body and what you're deficient in, what you are optimal in, and we can customize programs, whether that be for IVs, oral supplements, or maybe a combination of both. And so with what we do there, it's really a lot more testing, I would say, and listening to the patient. It's not the typical, you have 15 minutes with your doctor or your practitioner, and that's all you get. For us, we try to block out 45 minutes to an hour where our practitioners sit down and they listen to the patients. We do additional blood work. So whenever the results come back, our practitioners have time to really go through that and then customize a program. There's not a cookie cutter model to what we do. It doesn't matter whether you're there to talk to our nutritionist and we do gut testing to really identify specific what is going on in your gut. So then we can customize oral supplements and a diet, everything there. We really try to sit and listen. You, of course, can walk in and get an IV just like any other place. But what makes us a little bit different is we put our nurses through additional training in vitamins. So hopefully you don't just get the same answer of what does B12 do? What gives you energy? Our staff hopefully can educate you on all the different vitamins and how it may help different things in your body so that you feel a little bit more comfortable. It's not just a place to come in and get vitamins and leave. We want to spend a little bit more time and try to educate.
Okay. And then you talked a bit, or you mentioned diets, right? Like, what do you do? So it's like, okay, you're trying to take care of yourself, you eat better, hopefully, like you're taking the vitamins, you're missing some things, but you also teach or educate people of maybe some better food options, or tell me more about that.
So with our nutritionist, she has her own kind of journey that she's been on where she had a lot of problems that she really dove in and got educated in nutrition. And so she's got her story, which is great. But what I would say we do different is that it's so confusing to get a quote unquote diet, because you can get on the internet and you can read a million different things, and who really knows which one is right for you? So with the testing that we do, like I said, things like gut testing, it's a little awkward because you have to, poop in a cup at home to send off to be able to identify the bacteria in your gut. But through that test, now we can say, here's the supplements that you need, or here's the type of food that you should stay away from. So it's not always just a cookie cutter diet of do the carnivore diet and that's it. It may be stay away from these specific foods that may be part of a carnivore diet. So it's more in that type of manner that we try to do that. And so many people, you may get a diet that they say eat asparagus every day, something like that. Well, hell, you may have a reaction in your gut to asparagus that actually causes you to have bloating and not feel good anyway. So now you've read this diet that you're supposed to do to take or eat asparagus every day, but it's actually causing you more harm than good. But for you, it gets frustrating because you're like, I'm following this diet. What the hell's going on, Yeah, absolutely.
So do you guys test, like, say, before and then say implement some of these, suggested foods, and then do you test again later to kind of even like sort of see the what's the word I'm looking for, but like the journey, right? Is like, as their gut improving, are they reacting to different things?
Yes, sir. So depending on how bad your gut is and what all you have going on, it may be something that you just do annually. It might be something that you need to do once a quarter until everything is kind of squared away, and then you've got your plan.
Okay.
Other patients have been able to do it just once and don't have to worry about it because they're following a good diet that is customized for them, and they don't have to worry about it. But I would say even each one of our tests that we do, a lot of them are good to do annually, just to make sure that you're still following a good regimen. Even with our micronutrient panel specific for vitamins in your body, you want to check that every once in a while just to make sure that you're optimal, but not getting too carried away with it.
Okay. Very cool. You had talked before about ketamine therapy. Like, what are some of the benefits of that for mental health, and how have your clients received it?
Yeah. So ketamine to me is one of the most misunderstood treatments out there, because I think that it's gotten some bad rap through the press and things like that. But ketamine therapy has been used for a long time that has a ton of scientific results with this. In 2019, there's actually a study out there where they took 1 million vets and did a case study on them to help improve PTSD, mood. So there is a lot of data that backs that, because it causes neuroplasticity in the brain. So there's true science with it. For us, we really use the IV infusion way to do it because it's a therapeutic experience too. So you're kind of, for 1 hour, you're almost in your head processing or thinking of whatever you need to deal with, whether it be, we have some patients that have had sexual trauma at a young age that they still are trying to work through, police officers with PTSD. It's a little bit all over the board. The exciting thing for us is that we started with IV ketamine, But as new delivery systems are developed, we're able to build a entire program. So maybe you do something like ketamine infusions for six treatments, and then you're able to do something like nasal ketamine at home just to help relax a couple times a week if you have a lot of anxiety. Because the cool thing about ketamine is it doesn't have all the same side effects that all the SSRIs do. And so the hope for us is that we're helping improve all these things along the way. We don't want people to become dependent on ketamine. The idea is that this can help you improve your health, your mental health. We always encourage people to go to counseling and do all the work there. Ketamine is not some magic drug that just takes all the problems away. If that were the case, it would be amazing. But there's some work that the patient has to do for sure.
Okay. What challenges? Tell me about me. It's competitive, right? I mean, there's a lot of IV therapy out there. What strategies you're open to share that after you implemented to help you stand out more?
I think for us, it's education. That's been whenever we started 8.5 years ago. That was what we knew we had to do in order to get people to buy in. There's so many different places out there, and there's tons of even hangover places. We don't market to any sort of hangover type market because we want to be known as a place that helps educate, talk to you about proactively taking care of yourself with simple things like IV vitamins. So I would say what makes us stand out the most is that education that we can do with the patient that our nurses have been trained on.
And it sounds like it's, as you mentioned, more of a preventative. I mean, obviously, if there's something going on, if you're having some issues, come and see you. But at the same time, it's like, what can you do before you get to that point, right? As you were touching earlier, exactly. I was like, instead of like going to the hospital and then working backwards, because now you've already got a problem. It's like, what can you do to avoid that and have a healthier, fruitful life, and just your body's well taken care of and you're giving it what it needs.
Yeah. Well, and if most of our clients will come once a month on a proactive type of approach because you don't want to just wait till you get sick. I mean, there's plenty of people that obviously if you have flu or COVID or things like that, it's great for getting over those type of things, but taking an approach to just feel better. And when your vitamin levels are up and your hydration levels up, it's amazing just how the inflammation in your body stays down. And then how you're able to fight off infection because of those levels being up.
Okay, yeah, it's definitely a different way of looking at it. I mean, I love it because it's like, if you need to go to the chiropractor, you need to see a physio, you need to get some IV therapy, like do it as a monthly maintenance, right? Like it's just kind of like exercising, eating healthier, but do these things if you need it to help yourself out. Okay. All right. So I do have I got another question. I would love to learn a little bit more about what you guys are doing with corporate wellness programs.
Yeah. So it's a customized approach. Once again, I think so many places out there meet with companies, meet with HR, and they slide a corporate wellness program across the desk, and it's all the same cookie cutter approach. It's a lot of weight loss. But for us, we sit down with the owners, with HR, and say, what does a corporate wellness program look like for you guys? It could be obviously what you're going to talk to a construction company about is going to be completely different than what you talk to a bank about because you're two separate in style of employees there. So for say a construction company that there's a lot of workers that are outside in the heat, we want to talk to them about that preventative IV care because there is nothing that hits a business harder than if an employee overheats, has to go to the hospital because of heat stroke, and not to mention for the employee, how bad that is. So we have like a lawn care company that in the summertime, we show up first thing Monday morning, we hydrate all of their employees going into the week. So at least they have that bump of hydration when it's going to be hot. We have a convenience store company that we're talking with that we're talking about going to each one of their stores to do simple things like A1C checks because a lot of their employees have diabetes and it goes unchecked. And so then those employees end up going to the hospital. Well, that raises the insurance premiums for the next year. And so it saves money in the long run. There's obviously an investment up front, but the idea is for us to save money in the long run for the company, and hopefully helps with turnover and, all those type of things, because the employees feel that the company's investing in them. So that's a very long way of saying that we customize it for each, each employer, depending on their budget and what style of employees they have. We can get as creative of going store to store doing B12 shots and A1C, or we can have it where employees are able just to come to the clinic for certain services. We really just try to identify what their needs are.
Yeah. And it's like, even if it's like not the same thing, right? Like, again, you're kind of individualizing it, but you're offering it to the company, and then they can turn around and offer it as a benefit. They're not forcing you to do it. It's like, hey, this is a really cool thing. If you want to get checked out, and maybe they pick up some of the tab, or they, or
it's been a little bit of both.
Is it?
Some of them will pay for all of it. Some pay for half. Some just say, hey, here's a company that maybe IVRS offers a discount to the employees for them to do services with us. So it's a little bit all over the board. And some companies will do, depending on the level, their C-suite employees might be covered on a whole separate level than entry level employees. So it's all
like
over the board.
manager up level kind of thing. Sometimes they get a little better perks, and
yes, sir.
If they're they're putting in more hours and time.
Right.
Okay, yeah,
absolutely.
I love that. That makes sense. And so really, there's no limits. It's like, if you got people, you got stuff for the individuals, you got things for businesses. If they want to check it out. Sounds like all sizes.
Yes,
that's awesome. This has been very, very insightful. I appreciate this. Tell the audience, like, how can they reach you?
So for the company, we've got website, of course, www.ivrstx.com. And then me personally, I'm on LinkedIn. My email address is james@ivrstx.com. And yeah, I'd love to hear from anybody.
Excellent. All right. Thank you.